post-pandemic few years, they've been out to get nurses. I was ready to risk it all at that point. This is gonna sound like a stupid question. Maybe I should know this already. Girl, if you don't know it, we're gonna figure it out today. What's up, guys? It is your favorite nurse on shift and off shift. It's Nika. Today I'm going to be talking about tips for new nurses and seasoned nurses. Now this can help, honestly, anyone in any career, but I specifically speak to nurses because I am a nurse. I've been a nurse for 18 years. I like to give you all the exciting stuff from my experience, but I also want to give you the real deal and career tips that can help you. I'm going to go through 6 different tips, starting with the first one, and never be afraid to ask questions. Now, this is the first one for me because it's the most important for me. I have encountered so many people on the job that will come to me like, this is going to sound like a stupid question, or maybe I should know this already. Girl, if you don't know it, we're going to figure it out today. I've been a nurse for 18 years. There are a lot of things that I don't know. And I don't expect people, of course, that's just coming into the field, or even if you've been in the field, if you don't know it, you just don't know it. But you need to speak up. The reason why you need to speak up is because if you're going out there doing stuff that you really don't fully understand the concept of, you can be putting your patient at risk. And that's something we do not want to do. Nurses are held on a pedestal. We're honest, trustworthy field, and we just want to be, honest with ourselves. Speak up. It may be something that you just never did before. The number 2 tip I can give to new nurses and seasoned nurses and nursing students is great time management. I cannot say this enough. When you're in nursing school, you get that cushion of walking around with the instructor, having 1 patient, maybe 2 max. And then after you graduate, you're thrown onto the floor. Of course, you get a preceptor and you start with 1, 2, 3 patients. The day you get off of training, you're tossed there with 6 patients and you're expected to perform as well as someone that's been working the floor for ages. Time management is going to be the key to your success. I'm talking from the time you leave your house or even before you leave your house, preparing for work, preparing food, preparing for your lunch break, all the way up until throughout the shift. And then when you're getting off, you want to be able to get off on time. You're not going to always get off on time, but at least a decent time. I've seen nurses I've worked with stay after 2 and 3 hours, and I'm like, girl, I could never. Unless there's something that's detrimental and 3 emergencies went on towards the end of the shift, I'm getting up out of there and going home. The next tip for new nurses and experienced nurses, even nursing students, because we're preparing you to go into the workforce, you need to know you're going to have to embrace lifelong learning. And when I say that, this is learning on your own. This is forced learning through modules that they give you with the job. This is relearning whatever they taught you in school sometimes. We learn on a day-to-day basis. Sometimes we get to work and there's this new device that we have to learn about. There's modules we have to complete, yearly modules. We are expected to do continuing education, so those CEUs. It's going to be learning throughout. When I accepted the job as a nurse instructor, and started going back through anatomy and phys because I had to teach it, pharmacology, I teach it in med surg. Y'all, what? I'm like, why I don't remember learning particularly that. Y'all, it's a lot. But I've been a nurse instructor for a year and I can say right now I'm so confident I can teach just about anything. But y'all, when I first got there, I'm like, what? I was reading with my students. I'm going to be honest. I had experiences from working, but I needed to read the correct way, the exact correct way, not the seasoned nurse way. So the number 4 tip I have for new nurses and seasoned nurses is CYA. I know a lot of you guys know what it is. Cover your rear end. You have a license that you work really, really hard for. You don't want to just go out on a limb and lose that license. And y'all, in the past post-pandemic few years, they've been out to get nurses. It's not like any other profession where there's an accident. Whenever we have an accident, it is called neglect, and they try to find fault in the nurse. Don't look for the hospitals to back you up. Don't look for your colleagues to back you up. If you signed off on something, it is you. My advice, whenever you are charting, remember it to a T, and if you don't remember it, you are going to chart everything. How are you going to remember that day out of all the shifts that you work vividly? You're going to need some backup, and that's going to be your chart. And so chart as if you are going to court. I know that sounds like, ooh, but trust me, it's going to pay off. Even if you're not going to court, you may get pulled in the office because maybe someone fell, or one of the family members are pissed because they found their family member a certain way, or trying to put the blame on someone else other than themselves for them lacking. You see that a lot. So you need to know that you have charted, you have done everything that you can or could have done to help that patient. Y'all, this entire world is so litigious at the moment. It's crazy, and it's only going to get worse. So chart. CYA, cover your rear. The fourth tip for new nurses and seasoned nurses, I'm kind of going to hone in on a question I get asked all the time. How long should I be a nurse before I consider travel nursing? And let me tell you, this new generation, it can be 1 to 2 years. The older generation, me, I didn't start travel nursing till I was probably about 14 years in. Now, I started doing agency when I was about 5 years in, which is kind of like travel, but not necessarily leaving your area. You can do agency shifts in your area, but actual like local contracts, I didn't start until I was 14 years in. And the hospital I went to, I literally stayed at that hospital. I kept renewing the contract because it felt like it was my home. So the best advice I can give is you're going to be ready whenever you are ready. I can't say when you're going to be ready because who wants to wait 14 years? It was just convenient for me. I could have gone way before, but I didn't feel like it. I had kids, a husband. I was maintaining a life here. I just decided to step out on a limb post-COVID. Well, it was semi-post-COVID. It was still in the COVID area. And I was like, look, if I'm going to be put at risk for getting COVID and maybe a lifelong side effects, then I need to be compensated for it. And I was ready to risk it all at that point. I was like, what's the salary? It was looking good to me, and I was like, we're going to do this. So that's why I decided to do travel nursing. If it hadn't been for that little era or incident, I probably wouldn't have done it. I probably would have just did my little agency and called it a day, but I'm so happy I stepped out on that limb. As I said, I cannot tell you when you're going to be ready. You're the only one that's going to know when you're ready. Mind you, whenever you do step out, they have some mean people in this world. They have some people that don't want to help, but there's also some people that do want to help. And the hospital or facility you work for most of the time gives you a lot of resources. Okay, a lot of resources. You'll get training. You won't get that 6 weeks of training, but you will get like 2 to 3 full shifts of training, which should be sufficient enough to figure out what's going on at that actual hospital. You should already come with your background knowledge. 1 to 2 years in, if you're confident enough to do it, go right on ahead. The final tip for new nurses and seasoned nurses, also nursing students, we're prepping you to enter the workforce. Y'all, get into the money, not the emotion. I don't know how many times I have to say it. I don't have to remind myself anymore. I kind of learned that within the first couple of years of working as a nurse. And honestly, I already came to that realization when I was working as a LPN, CNA, just working in healthcare. As I said before, there are mean people. Not everybody wishes you well or has your best interest, but you know that you have your best interest. When people do stuff to you, don't think like, oh, they are just out to get you. You have to think in your head, why would they want to be coming after little old me? Now, some people want to put their time and effort to come after little old you, but let's be honest, people got other things going on in their life, family. Sometimes you're not even the target. You were the next closest thing, and that's that. I don't take anything personal. If you offend me or think that you offend me, I probably can still be receptive to anything you say within the next 30 minutes or the next time I see you. That's just me. If you are somebody that takes stuff personal, I need you to always remember to treat the hospital like It's a business, and that goes as far as supervisors, managers, co-workers. You want to get to the money, not the emotion. Go in, do exactly what you're expected to do, collect your hours, and go home and wait for your check. I know it probably sounded like no compassion was involved, but do exactly what you're expected to do. Take care of your patients. You want to be taken care of. Do exactly all the charting you need to do. Follow hospital protocol and go home at the end of the day. If it's a hospital, it's a 24-hour facility. What you don't finish, there's another person coming. You want to try to complete as much as you can. Chart what you need to chart and go. I can have the worst shift in the world and no one will know because I left it. I left it on the hall. I left it in the room. So that is my 6 tips for new nurses, seasoned nurses, and nursing students because we're prepping you to enter the workforce. If you found this video helpful, I want you to hit that subscribe button if you are not already a subscriber, and welcome to my community. I want you to share it with colleague, coworker, friend, classmate, and until next time, bye.